నా పేరు బేబీ. మేము సాయినగర్లో ఉంటున్నాం, బాచుపల్లి దగ్గర సాయినగర్. ఇట్లా మా మనమరాలకు చాలా చోట్ల చూపించినాము. ఖాళీ జ్వరం అని చూపించినాము అక్కడిక్కడ. జ్వరం రోజు రోజుకు పిల్ల శుక్రవారం బాగుంది. ఇంకా సోమవారం రోజు నైట్లో చాలా డల్గా అయిపోయింది, పిల్ల చాలా నీరసంగా అయిపోయింది. అట్లే మా 2:30 ఉంటుంది, నైట్ 2:30 ఉంటే నైట్లో పిల్లకి ఏమైపోతుందని తీసుకొచ్చాము. మన ఈ హాస్పిటల్ మాకు ఎప్పుడు పరిచయమే. మా ఆయనకు మా వాళ్ళకి అంత ఎక్కడ చూపిస్తాము. ట్రీట్మెంట్ బాగుంటుందని, ట్రీట్మెంట్ బాగా చూస్తారని ఇక్కడ తెచ్చాము. తెస్తే ఆ రాత్రి 2:30 టైం, 2:30 ఉంటే చాలా కండిషన్, పిల్లలు చాలా సీరియస్గా పడిపోయింది.
Hello everyone, I am Dr. Suleiman Dosani, consultant critical care at Prathima Hospitals, Kokatpally. I would like to discuss one case recently we had. A child of 11 years old presented to emergency department in a semi-conscious state, in a gasping breath with an altered sensorium. On evaluation, we found to have that she was having sugars of more than 500 mg per deciliter, with her blood being severely acidic with a pH of 6.7, and she was in a state of shock. She was diagnosed to have severe diabetic ketoacidosis with shock with cerebral edema. It took almost 2 days to stabilize her, to bring her out of the shock and from cerebral edema. It was a multidisciplinary approach with intervention from a pediatrician, Dr. Hanumant, from endocrinologist, Dr. Anish, and neurophysician, Dr. Deepti. So we, as a team approach, we have handled this care. So today we would like to emphasize on juvenile diabetes. In this case, even the family were very astonished to hear that even kids can have diabetes. So something about juvenile diabetes, it's a type 1 diabetes where in our body insulin production is almost insignificant because of the destruction of the cells which produces insulin from an endocrine gland called as pancreas. We should be aware of certain signs and symptoms to see or to identify, which we generally see in adults with a routine screening, but in a pediatric age group we do not have these routine screenings. So certain signs and symptoms which we can see or appreciate is having repeatedly falling sick, child having frequent urination, or they are having frequent abdominal pain, or having some paresthesia like symptoms in the child's leg. So these are the frequent symptoms where if we are noticing, we can early approach to a pediatrician and then further evaluate. On further enlighten about this type 1 diabetes mellitus, our endocrinologist will speak in detail.
Hi, this is Dr. Anish Kolli. I'm the consultant endocrinologist at Prathima Hospital, Kokatpally. I'd like to discuss about a case which we recently saw. So she was an 11-year-old girl. She was brought to us to the emergency department with altered sensorium. She was drowsy from the past few days. She wasn't eating well. She was complaining of some stomachache and vomitings. And we found out that her blood sugars were pretty high. They were more than 500. So we had treated her. Her pH was 6.7. Over my last few years of practice in endocrinology, I haven't seen a pH so low of 6.7, which was extremely low. Her bicarbonate was 1 to between 1 to 2. And she was not even in her senses from the last 12 to 14 hours before she came here. So we had treated her with IV fluids initially, and then we gave her insulin. And during the course of treatment, we found out that she also had a little bit of hypokalemia, and even hypophosphatemia was there, for which we had given her potassium phosphate as an IV solution. And we had monitored her accordingly based on that. We also got found out that she had a bit of viral meningoencephalitis or meningismus, for which the neurologist consultation was taken and she was treated appropriately. So the reason I'm talking about this is the patient and most of us, we don't believe that type 1 diabetes is an entity. We think that diabetes is a problem which is only seen in the elderly people, but I would want you people to always recognize that there is a chance that diabetes can occur even in children. It's a different type of diabetes, and the patient actually did have increased urination from the past couple of months. She used to wake up during the nights to go for urine. She had lost a little bit of weight, but she was not shown for that because the lack of awareness of this condition was there. So this was a very tricky case to manage. The patient did come to us in a critical condition and the patient is now being discharged in a very healthy condition. So if at all any of you people are having a child who is losing weight, who is having increased urination, who is having genital infection, who is having vomitings, immediately take the patient to the nearest doctor and get her evaluated for diabetes and make sure that it's taken care of well.
లాస్ట్ కండిషన్ తెచ్చాము పిల్ల ఇట్లా ఉందని తెస్తే దబ్బున చూసి సార్లు మేడంలు చూసి కండిషన్ చూసి పిల్లని బాగా పట్టించుకున్నారు. చూసి మంచిగా డాక్టర్లు అందరూ వచ్చారు, మంచిగా చూశారు. చూసి ఇంట్లో ఇంత కండిషన్ ఎందుకు పెట్టుకున్నారమ్మా, ఇంత సీరియస్ అయ్యాక ఎందుకు పెట్టుకున్నారు, లాస్ట్ స్టేజ్కి వచ్చేసింది పిల్ల, షుగర్ ఎక్కువ అయిపోయింది, ఇంత ఎందుకు పెట్టుకున్నారని. మాకు తెలియదు సార్, తెలియకుండా ఇట్లా తెచ్చాము, మాకు షుగర్ అని రాదు కదా, తెలియకుండా తెచ్చాము. ఇక్కడ వచ్చిన తర్వాత మేడం వాళ్ళు చెప్పిన తర్వాత మాకు తెలిసింది. రాంగల్ మంచి ట్రీట్మెంట్ బాగా పట్టించుకున్నారు.
I am Dr. Deepthi, consultant neurophysician in Prathima Hospitals, Kukatpalli. I saw a 11-year-old girl. She was brought in a state of altered sensorium and breathlessness to Prathima Hospital's emergencies. When I saw her, she was in altered sensorium in a stupor state, and when I am stimulating her much only, she is opening her eyes and responding. And when I examined her further, I found meningeal signs in her and she is in lot of pain too. And she even had metabolic acidosis which was corrected in time. And because of these neurological signs, when I examined her, I advised her for CT and it showed lot of cerebral edema in her. Because of that cerebral edema causing much of the tension in the brain, she was in altered sensorium. When cerebral edema is not treated in time, it will lead to death of the diabetic ketoacidosis kids. When I saw cerebral edema in the CT, we immediately gave medications to treat the cerebral edema. And she immediately regained consciousness when her edema came down. In about 1 to 2 hours, she regained consciousness and she was completely fine later. So I want to emphasize that diabetic ketoacidosis is an emergency and many kids won't complain any of the diabetes symptoms because increased thirst, increased hunger, increase in urination, which we take it as normal children aging thing. Whenever parents saw any kid with excessive weight loss in recent days with lot of they will be eating much but they will be losing the weight, and when they have even more infections, then parents should be alert and they should get evaluated for these diabetes. So usually kids, they present in ketoacidosis stage only. Whenever they have any infection, their diabetes will get complicated and they will present with ketoacidosis stage. They will have lot of acid in the body and they will be in altered sensorium like that. Diabetic ketoacidosis is an emergency and it should be treated in time. Otherwise, there will be lot of neurological complications which will have permanent sequelae. So be alert and get your kid evaluated when they have any of these signs.
మా పాపను బాగా దగ్గరుండి అందరూ చూసుకున్నారు, ఇంకా అన్నీ బాగానే చూసుకున్నారు. సార్ వాళ్ళు, మేడం వాళ్ళు, ప్రతి ఒక్కరు అందరూ దగ్గరుండి ఆయమ్మలు ప్రతి ఒక్కరు బాగా చూసుకున్నారు. పాపను కండిషన్ బట్టి మంచిగా చూసుకున్నారు. పిల్ల మంచిగా అయింది. మా మనమరాలు ఇక్కడ కోలుకుంది. అంత రేత్రి సమయాన మమ్మల్ని బాగా చూసుకున్నారు, బాగా పట్టించుకున్నారు. నర్సులే కానీ ప్రతి ఒక్కరు బాగా చూసుకున్నారు. అందరూ ప్రతి ఒక్కరు బాగా చూసుకున్నారు. హాస్పిటల్ ప్రతి ఒక్కరు పట్టించుకున్నారు. అందరికి థ్యాంక్స్ చెప్తున్నా బాగా అందరికి.